Everyone, good morning. Thank you for your patience there. We had a short technical issue. I tell you, technology is great when it works. But anyway, thank you very much for your patience, and I promise to finish up on time. Hope your day is going well wherever you are today on this beautiful fall Tuesday. My name is Jason Cogdell. I'm a benefits attorney here at ProBenefits, and I'm with Jamie Rohr, who's one of our plan setup and design experts. And this session is going to be focused today on HRA plans, employer-funded accounts that allow us to provide tax-free benefits to employees for medical expenses, dental expenses, vision expenses. And we're going to give kind of an update and refresher on HRA plans and some of the options that are available, some of the compliance requirements. Won't beat you down too much for those requirements because I want to focus the majority of our time allowing Jamie to talk about some plan design options and what we're seeing in the market and some options for your organization or for those of you who are plan design who are plan advisors and insurance advisors, that some designs for your employer clients. And I will provide a short update as well on the popular topic one of the popular topics of 2015, individual premium reimbursement by employer. So thanks for joining us. Your questions are welcome anytime. The best place to submit the question is through the question box on the control panel. If you submit the question, it'll come directly to me and Jamie, and we'll try to get those questions covered during the session. If there are any we miss, we'll get to you afterwards. So thanks for joining us today. Just to launch right into it, and as a quick refresher, HRA plans are a plan design that has been around since 2002, and the key theme for HRAs is this. First of all, they're entirely employer funded. No employee dollars fund the HRA account. It's all employer money, and that's the case both on a funding basis, and accounts can be funded one time annually or on a monthly basis. And it's also true at termination, because anytime an HRA plan is terminated or an individual terminates employment, the money stays with the employer. It's not an individually owned account like a health savings account. The big reason to have an HRA, of course, is that it allows the employer to provide this money tax-free to the employee. So as long as it's to an employee or an eligible spouse or dependent, then the reimbursement is tax-free to the employee, and it's fully deductible for the employer, the same way that the employer's contribution toward, for instance, group health insurance coverage is. So the tax savings are significant. There are a lot of different HRA plan design models, and Jamie's going to go into more detail, but all of them include those two basic tenets. They're employer funded, and the qualified reimbursements are tax-free to the employee. The primary HRA design model continues to be the deductible reimbursement plan or coinsurance reimbursement plan that's paired with a major medical insurance plan. But there are other categories. Some HRAs reimburse, for instance, only dental expenses or vision expenses or prescription drug expenses. Some reimburse all out-of-pocket expenses that the IRS code allows under Section 213D. But the key, and Jamie will cover this in more detail, the key is flexibility. The employer can effectively do whatever it wants to within certain parameters and with certain rules. As we start to look at those rules, and I'm not going to go through all of these in detail, and we will provide you a copy of the slides in case you would like more information, but the key rules that apply to HRAs are these. First of all, these are plans created under IRS rules, so we have to follow the IRS rules. The primary rule is that the expenses reimbursed by the HRA have to be approved by the IRS code, and those, again, are any out-of-pocket medical, dental, or vision expenses allowed by IRS Section 213D, and that primarily means any expenses that are for treatment. Some preventive care expenses are not reimbursable. The expense has to be for treatment of a medical condition, medical, dental, or vision. Also, again, we can only provide the expenses for the employee, the employee's legal spouse, which now includes a same gender spouse, and any qualifying dependents, and those are children or other qualifying tax dependents up to not only the tax dependent limit of age 19 or 23 if a full-time student, but all the way up to age 26 under the ACA rule. There are non-discrimination rules under the IRS code. The short explanation there is that everyone needs to be treated the same in terms of eligibility for the plan and available reimbursements under the HRA. So the IRS rules are the primary rules that the HRA must follow. There are also some ERISA rules. The HRA is an ERISA plan because it provides group-sponsored health and welfare benefits. So the ERISA eligible HRA plan needs to have a plan document. It needs to have a summary plan description that's kept updated that describes eligibility, what eligible expenses are, and other specific terms of the plan. And that SPD should be kept up to date and distributed by participants. COBRA applies to HRA plans. They are subject to COBRA. Traditionally, COBRA for an HRA plan has been simple. It's just been one election provided to the individual who loses group health coverage and HRA coverage, that the individual could elect to take medical with the HRA or not. Now, under ACA rules, there are effectively two elections. You can elect to take the health insurance plan with HRA or the health insurance plan without HRA. Typically, you can't elect COBRA for the HRA plan only, and those are some relatively new rules, but the short story there is COBRA applies to all HRA plan designs. Common question: what owners may participate? And some of you may have participated in a mini webinar that Chris McCauley led earlier in the year regarding owner participation. The key with HRA plans is that the same rules that apply to Section 125 and pre-tax benefits also apply to HRA plans, and that the only individuals that can receive tax-free coverage are common law employees of the employer, eligible individuals, or a certain specified number of other individuals. Example, in a C Corp, any individual, including individuals with C Corp ownership, can receive tax-free coverage. In an S Corp, however, or a partnership or an LLC, just like a single individual proprietorship, the owner cannot receive tax-free benefits. So if we have an S Corp, partnership, or LLC, if the owners, members, partners are made eligible for the plan, then any reimbursements provided to those individuals would be taxable, because LLC members, partners, and S Corp owners cannot receive tax-free health benefits in any form, and that includes HRA. If they are provided reimbursements, those should be shown as taxable income on the end of the year statements. A similar analysis applies to any domestic partner who's not a spouse, and that would be true same or opposite sex, or any other individuals who are ineligible, any non-spouse, non-dependent that's provided coverage, that would be taxable instead of tax-free to the employee. Another highlight of our compliance requirements, and probably the one that's least known among all compliance requirements for HRA plans, is that there is a Medicare secondary payer reporting requirement. Some of you may know this, but all group health insurance plans report to CMS, which is the Center for Medicare and Medicaid Services, on a quarterly basis. And the reason for that is that CMS is helping to ensure that individuals that receive Medicare benefits primary are not also receiving group health plan benefits, because theoretically for an active employee, the group health plan benefit should be primary to Medicare. So CMS requires health insurance plans to do quarterly reporting to show who's covered by a plan or who's eligible but not covered by a plan. Most of us don't even know about that because the fully insured carrier or the self-funded TPA is handling that reporting for us. And in this case, HRA plans, first of all, must report. The only exception is for plans that have a maximum annual reimbursement amount of less than $5,000. So if your plan has a maximum annual reimbursement plan of $5,000, this will be for any level of coverage, individual or family, then your plan does not have to do MSP reporting, and you're exempt from that. But any plan that has a maximum reimbursement of $5,000 or more has to report. In fact, we, ProBenefits, as a third-party administrator, we actually report on behalf of our employer clients. We are the required reporting entity. But for a self-funded plan or plan that doesn't have an outside TPA, the employer must do the MSP reporting. This has become effectively the largest barrier, for self-administration. And if you are an employer who's self-administering a plan, or you're an advisor and you have clients that are self-administering plans, know that on the list of required compliance items for HRAs is this Medicare secondary payer reporting requirement, which is on a quarterly basis to CMS, and it's a file that we provide quarterly to CMS to help those rules, help the employer comply with those rules, and us as the TPA. Just want to mention that, since that's not a very well-known rule, something that has become a more well-known rule, and this would be part of the ACA compliance changes that apply to HRAs, is the new P-Corps fee. And it's not really new anymore because it took effect for the first time for plans that ended at the end of 2012. But the P-Corps fee is basically the nuisance fee, the one-time per year fee. It started off as $1 per participant per year for plan years that ended between October 2012 and September 30th of 2013. The fee is payable for 7 consecutive plan years. In the first year, it was $1 per participant. In the second year, it was $2. It was indexed, so the third year was $2.08. And last week, it was announced that the fee for plan years that ended this month through September of next year is $2.17. The P-Corps fee is paid by all HRA plans. All HRA plans that are reimbursing health expenses must pay the P-Corps fee. Again, it's a nuisance amount, so the key is just that we comply with it. It's due with IRS Form 720 on July 31st of the following plan year. So as an example, any plan that ended in 2014, January to December of 2014, that was due by July 31st with IRS Form 720. Any plan year that ends in 2015 will be due by July 31st of 2016. We provide assistance with P-Corps fees for employers that we administer HRA plans for. We will calculate the fee, send you the populated 720. Some of you are used to that process by now. If you're an employer self-administering a plan, know that this is something you've got to do, and if you haven't done it, frankly, it needed to have been done. So this is something that you should know. We've got a one-page summary. I'm going to try to key it up here. A one-page summary of the fee. Hopefully you can see the PDF now. And just scrolling down, you'll see this is what the fee is. It's basically a staggered fee now that depending on what year you're paying it, when the plan year ends, the fee will be slightly different. You'll see that this summary has been adjusted to include the new $2.17 fee for plans that end either at the end of 2015 and are due in 2016, or plans that end in the first 9 months of next year, which will be due in 2017. So those of you who have HRA plans with us know that this is something that we're taking care of on your behalf, and basically all you'll have to do is receive the Form 720, sign it, submit it to with a check to the IRS. But again, those of you who are putting in new plans, just know that this is something that you'll need to account for. The fee itself, again, is not large, but it is a key compliance requirement. And just as with other ACA rules, the key is that we comply with it and not omit that requirement. So we wanted to mention P-Corps fees as a new requirement. Another new requirement, and going back to some 2013 guidance issued by the IRS, is that we can no longer have HRA plans that are not linked to group health coverage. Traditionally, one option would be for an employer to have an HRA plan even if it did not have a group health insurance plan, or to provide an HRA benefit for individuals that did not elect coverage in the group health insurance plan. Unfortunately, under the ACA, we can no longer do that because the ACA rules require, and the same is true of health FSA plans, that they must be sponsored by an employer that has a major medical plan, and in the case of an HRA, the HRA plan eligibility needs to be linked to the major medical plan eligibility for the HRA to be compliant as a plan under the ACA's market reform rules. In the interest of time and the sanity of all of us, I'm not going to go into detail on those rules, but if that's a topic that you need more information on, we'll be happy to provide it. The short story is this. If the HRA reimburses medical expenses, because there is an exception for dental or vision only plans, which are HIPAA accepted benefits. If the HRA reimburses medical expenses of any kind, the HRA must be linked to the group health insurance plan. That doesn't mean it needs to be administered by the group health insurance carrier. That's a misnomer in the marketplace. It can be administered by the employer, or even better, a TPA like ProBenefits. and be compliant, but the eligibility has to be linked, and the HRA has to stand on top of or supplement the major medical plan. The HRA cannot be linked to individual coverage and satisfy the ACA rules. That won't work. And furthermore, the HRA cannot reimburse individual or marketplace premiums for active employees, even though traditionally that's been an option. And the IRS code itself and IRS guidance has not been amended to make individual premiums an ineligible expense under HRA rules. HRAs cannot reimburse individual marketplace premiums for active employees. So this is a new requirement. I mentioned earlier there's an impact on COBRA. These new integration rules require, number one, that employees have the opportunity to opt out. So hypothetically, and this is in our plan documents that we provide to employers, hypothetically, an employee who enrolls in the health insurance plan but wants to opt out of the HRA for whatever reason could opt out. Now, we're not seeing any employees opt out, but that's technically an option that has to be provided to participants. Secondly, we've had to tweak the way COBRA is administered for HRAs. Again, traditionally, since the HRA is linked with the group health plan, there would be one election. The employee, upon loss of coverage, would elect with one COBRA rate to continue coverage in the health insurance plan plus the HRA together, again, for one COBRA premium, one election, yes or no. That was the employee or former participant option. Now, there are basically two options, to do the exact same thing, health plan plus HRA, or to continue the health plan by itself without the HRA. And this is a good change. Most employers are in favor of this change. Since there theoretically are two different rates, the employee or former employee is likely to take the cheaper option and just take the medical plan, which keeps them out of the HRA as a COBRA participant. Generally, the employer is in favor of that. One question submitted, why would an employee opt out? Again, we haven't seen it. The theory behind the guidance is that the employee needed to have this option, whether, in some scenario, the employee may opt out of the HRA to protect HSA eligibility or, for other personal reasons, but through about 1 year, one full year of administering plans with opt-out provisions, we haven't seen anyone opt out yet. So I don't think it's something that we'll see going forward. Just as a final word about some of the ACA changes, HRAs are required to have SBC, Summary of Benefits and Coverage. And just like with the major medical plan, this is something that should be provided to employees each year and updated. The SBC could be provided separately, which most are, or it could be provided as part of the medical plan SBC. Frankly, since the carrier SBCs generally cannot be modified, most employers just provide a separate SBC. That's something we provide for our employer clients so that you can comply with the SBC requirement. We know that employees aren't reading them, but we're providing them nonetheless to help you comply with those requirements. And also, along with what HRAs must comply with, it's important to know what HRAs do not have to do. HRAs are not subject to the required contributions to reinsurance. And those of you that are sponsors of a self-funded health plan or advisors, you know that the required contribution to reinsurance will be due between now and the end of the year. The participant counts for self-funded major medical plans are due November 15th, and this is a significant fee. It was $63 per participant for the year in 2014. It's $44 per participant per year, and that includes the employee plus dependents for 2015. That amount will be reduced for 2016. That applies to self-funded major medical plans, but it does not apply to HRA. So that helps avoid a major cost implication for HRA. So that's good. As of now, the new W-2 reporting rules that apply to employers issuing 250 or more W-2s, they do not have to report HRA coverage as part of that. So that's a good news. Only major medical plan values and coverages have to be reported on the W-2s. And then also, importantly, the new instructions for the new IRS reporting rules and specifically IRS 1095C and 1095B for self-funded plans. The recent guidance issued September 18th confirms that HRA plans do not have to be reported separately from major medical. So if the employer is reporting major medical, it doesn't have to separately report HRAs as self-funded coverage. That's good news for HRA plan sponsors. And then a final word before I turn it over to Jamie. It remains true on a continuing basis that one of the hot topics that we get questions about, and which remains a key topic for employers, and particularly small employers and nonprofits, is the concept of premium reimbursement. Premium reimbursement is something that employers have traditionally been able to do to allow employees who are not on the group health insurance plan or spouses to go out to get individual coverage, or in the ACA era, marketplace coverage, and then the employer reimburse that coverage or pay the carrier for that coverage rather than that individual being on the group health insurance plan. This has primarily been a strategy and approach for small employers, although employers of all sizes have used it to some degree. The ACA, as many of you know, has changed all of these rules, and effectively under the ACA, employers cannot pay for or reimburse individual coverage or marketplace coverage for active employees. And that is true whether the employer wants to do it directly by paying the carrier or reimbursing the employee, or through an HRA plan. So it is true, despite what some people nationally may claim to have some type of creative workaround, it is true that the employer cannot fund tax-free or with taxable income individual or marketplace coverage. The only way to be able to do it would be to provide additional taxable comp, salary, bonus to an employee, and that taxable comp would not be tied to the purchase or reimbursement of individual coverage. Now, there are no exceptions for active employees. The only exceptions would be, first, arrangements that benefit only non-active employees. And an example would be retiree plans. An employer can reimburse individual marketplace coverage for retirees, and Jamie will talk more about that in a moment. Also, there is technically a fewer than two rule that, in the same concept or analysis that applies for retirees, would apply to an arrangement that benefited only one active employee, since the ACA rules, just like ERISA, generally apply to an arrangement that has two or more participants or employees involved. Also, a common question, what about spouses coverage? Can we send the employee who goes on to spouses coverage, can we help provide reimbursement for that coverage? And the answer is yes, but on a taxable basis. We can reimburse the employee's share of coverage if he or she's on spouse's group plan, but that would be taxable because spouse is paying for that coverage on a pre-tax basis through spouse's employer's Section 125 plan. So we can't have tax savings on this side if we've already got them on the other side. So that coverage would have to be taxable. There was some limited transition relief from this rule for small employers under 50. That transition relief expired at the end of June. So it is 100% true that now, after June, any employer of any size that is reimbursing tax-free or taxable individual coverage or marketplace coverage for active employees is subject to potential ACA risk, which is significant, up to $100 per employee per day. So even though, especially for those of you that are small employers or nonprofits, even though it's unlikely that you would be caught in an audit, the risk is just too great. And so our clear recommendation to employers is don't reimburse individual coverage. Don't pay the carrier. List billing is a thing of the past for active employees and individual coverage. If you want tax savings, you've got to provide it through a group plan, major medical, or HRA for eligible expenses. If you want to help employees that are not on the group health plan with individual coverage or with payment for their coverage under spouse's plan, you've got to do that with taxable comp. And there are just no other exceptions other than for retirees or for a single participant arrangement, and that's just kind of where we are. Jamie.
Jason, I'm going to shift gears back to the P-Corps fee real quick. We've had a question come in regarding a group that's reimbursing deductible expenses, and they're fully insured, but do they need to pay a P-Corps fee? I had responded back that they do, and so the question came in, well, what if they've never paid the P-Corps fee so far? What advice would you have for that employer?
To my knowledge, we do not have specific instructions about how to make up missed PCOR fees. Some employers who have failed to pay it within that same year have just gone ahead and submitted Form 720 late and just hoped it was accepted by the IRS and not challenged. I think the employer basically has two options. Number one, to file the 720 for the prior years and just go ahead and pay them all at one time. That's probably what I would recommend. And I doubt the IRS would come back on the employer for anything other than potentially some interest. But the dollar amount's so small, the interest wouldn't really matter anyway. And then certainly the other option would be to not make them up and just start with the current year and move forward. That practically that may be what the employer does, but I think there would be an option to just file the Form 720 late for the prior year. File them now, maybe include a cover letter to the IRS, explaining the error and just asking them to accept it with no further penalty or interest. So that's probably what I would suggest.
Thanks, Jason. Before I get into my part of the presentation, by the way, I am Jamie Rohr. I'm one of the benefits consultants here at ProBenefits. Wanted to address one other question I see that came in. We talked about the COBRA implications of having an HRA, and the question came in, how do we determine the COBRA value of the HRA? Certainly, that is something that is a little bit subjective when it comes to different employers, but we have a little piece, a reference piece. If you want that, feel free to email in for that in terms of calculating that COBRA value. Basically, as I tell employers when I'm talking with employers about their HRA plans and they're trying to come up with a COBRA value for the HRA, I advise them to first off look at what the maximum reimbursement is for that particular level of coverage, so employee only or employee plus spouse or family coverage, whatever it may be. So look at what your maximum reimbursement is, and then based off of your plan design, we can kind of come up with an expected utilization for that HRA reimbursement. So if we think the utilization is going to be 25% on a $5,000 reimbursement, then the expected claims payout is $1,250. Well, you take that $1,250, divide it by 12 months, and that would be your COBRA premium or your COBRA value of the HRA. So certainly, again, that's something that we, for all of our HRA clients, we can definitely assist them in guiding them to come up with that calculation. Ultimately, it's really up to the employer to come up with what the value of the HRA COBRA coverage, of the COBRA value of the HRA coverage. Well, let's get into the nitty-gritty of HRA plans and in terms of plan designs. Jason's already touched on several of these, and I think these are important points to just emphasize again. HRAs carry with them maximum employer flexibility. The employer can reimburse what they want to within the guidance of the IRS 213D expense rules. Now, obviously, that is subject to whoever you're using for your HRA administrator. It's subject to any particular constraints they might have in their administrative system. Maybe there are a lot of administrators out there that only want to do certain plan designs, particularly if you're talking about a carrier-offered HRA product. They have a set number of plan designs, and that's all you can pick from, whereas HRAs truly allow employers a lot of flexibility if you're working with administrators that have that flexibility. Significant cost savings. Really HRA plans come into play when a group is looking at their insurance plan for this year and what it's going to cost to renew that HRA plan for next year. And then they look at an alternative plan and pairing it with an HRA. So if you can find some significant cost savings there, it makes sense to go with the alternative plan with the HRA, and that's the beauty of what HRAs bring into existence is some significant cost savings when we're looking at just renewing a current health plan. HRAs can be used with any health insurance plan. You all know that HSAs, if you talk about health savings account, they have to be paired with a very certain type of health plan. HRAs can be used with any type of group health insurance plan that a group has. Positive step towards consumer approach, and what that means is HRAs in a lot of ways can help expose your employees to the cost of their health expenses. If an HRA is integrated with the health plan, and employees have to file claims for their HRA expenses, they actually have to look at an EOB or look at how much a service costs and really start to be mindful of, okay, when I go get that MRI, that's going to cost me $1,500. Is there another option, doctor, that we could undergo that might give me the same result? So employees are exposed more to the cost, and then HRAs there's very little cost to the employer to implement an HRA. Key, again, Jason's already mentioned this, flexibility, flexibility, flexibility. We could probably put this at the bottom of every slide just to emphasize that. Trends that we're seeing in the marketplace in terms of HRA plans. As Jason has already talked about, there are no standalone HRA plans anymore that have any kind of medical expense reimbursement component. You can certainly have standalone for dental or vision or retirees, but no standalone HRAs that reimburse any type of medical expense. As Jason's already mentioned, that's had a huge impact on a lot of small employers that have no group health plan that had a standalone HRA. I wish we could give those employers better news in regards to that, but that's just a change that's come about over the past year or two. Deductible reimbursement plans still account for the majority of HRA plan designs. These deductible reimbursement plans, basically a group says, all right, our health plan this year has a $2,500 deductible. Next year, it's going to have a $3,500 deductible. So we, the employer, we want to reimburse our employees for the back end $1,000 of that deductible if they incur the expenses. That's a very common, the most standard type of HRA plan design that we have on the books here at ProBenefits, and I think that's common across the whole benefits industry. The reimbursement structures can vary greatly. You can do front-end deductible reimbursement, back-end deductible reimbursement. You can do percentage reimbursements. We have all different kinds of plan designs here at ProBenefits of the HRA plans that we administer. So there's a beauty in being able to structure that reimbursement how the employer wants to structure it. And that's dependent upon specific employer objectives. Also, the bottom bullet point here on this slide, deductible reimbursement plans actually can be a valuable tool for an employer that has already made the move to go to an HSA eligible health plan and implement HSAs. The employees are allowed to open up HSAs. That deductible, even though you've made the choice to go to an HSA eligible health plan, that deductible is probably going to increase over time because you've still got to manage the premium cost in regards to that group health plan. So an HRA can be paired with the back end of that deductible on that HSA eligible health plan to assist employees with that ever-increasing deductible. So that's a question that I get, and I know our other two benefits consultants in our office get a lot. Can we pair an HRA with an HSA-eligible high-deductible health plan? Absolutely. If you want your employees to be able to set up HSAs, though, we have to protect the qualifying HSA deductible amount. And for this year, as you all know, or probably have to look it up every time like I do, the qualifying deductible amount this year to be eligible for HSAs for employee-only coverage is $1,300. For family coverage is $2,600. Next year, I think that bumps up by $50 or something. Oh, it stays the same actually next year. I forget that. So yeah, protect that deductible. You can do an HRA on the back end. Other continuing trends when we're talking about HRA plans. Certainly, we can move past the deductible reimbursement plan and we can get into coinsurance reimbursements and other components such as prescription reimbursements. That's becoming more popular. Obviously, if we're reimbursing for coinsurance now, that's a little bit more complex due to the new Affordable Care Act out-of-pocket max rules. Now everything is being factored in the out-of-pocket max, whereas we just used to have a coinsurance max. So with a group that wants to reimburse coinsurance, we certainly have to talk through the issues there. But again, prescription reimbursement is another popular one, and we'll talk about a sample plan design in a second. Full 213D HRA plans, sometimes with carryover are increasingly being utilized as a valuable benefit. So a group has a group health plan, they tell the employees, we're going to give you a bucket of money, and you can use that bucket of money to reimburse any out-of-pocket 213D expense, just like a flex account could be used for, a health flex account, or an HSA. So groups are becoming more and more aware that you can do that, and pairing some 213D HRAs with the group health plan. Expenses in a plan that's reimbursing 213D expenses, the expenses can be restricted to one category, such as like a dental only type plan design, and I think we're going to touch on that a little bit later. Retiree HRA plans, as Jason has mentioned, they are on the rise in an effort to control retiree budget cost. Certainly if an employer has told their employees, we're going to provide you group health coverage after you retire, well, that expense was not, that expense is a lot higher than what they had anticipated that expense to be 15, 20 years ago. So now a lot of companies are moving to retiree HRA plans to help control those costs. Let's look at a couple just plan design options, and we've kind of talked about some generalities of what those options are, but let's look at a couple concrete kind of sample designs. Let's say that you're a group, you want to do a deductible reimbursement plan with a copay that has a copay reimbursement component. Typically, if you're going to do a deductible reimbursement, you've got a health plan that has a mid to high deductible on the group health plan. And let's face it, most groups now do have a mid to high deductible. It's very rare that you see the $500 deductible plan anymore. So the employer says we're going to self-fund a portion of that deductible and a portion of some category of copays. So here's a very basic example. Let's say that the old health plan has a $2,500, $5,000 deductible for employee-only family coverage, and then they have a $50 specialist visit copay. Now, in order to help control cost, premium, they're getting hit with a 35% increase at first estimate. So they're looking at, okay, what can we do? So they increase the deductible on the health plan to $3,500, $7,000, and they increase the specialist visit copay to $75. What that employer could do is they could implement an HRA to reimburse the back end $1,000 of that deductible. For each deductible tier, and then they could also reimburse $25 of that specialist copay to get it back to the old $50 copay if that's a big concern for the employer. So that's one very simple example of what an HRA could do.
Jamie, can you talk about a little here about the options that an employer would have, and then maybe the difference in customization between what we can help an employer do versus some of the cookie cutter carrier options?
A good question. One of the questions that I get all the time, and I'm sure that Charles Crabb and Kim Maliolo in our office get quite a bit as well, is what can you bring to the table? We've got this offer, we're going with this health carrier, and they tell us that they can do the HRA for free. Well, what you're facing there is that health carrier has a very definitive list of HRA options, and most of those, from what I have seen, they're just very basic reimbursed back-end deductibles, just very basic type of options. Whereas we, as an outside independent administrator, we can custom that, tailor that plan to what the employer wants to do. Again, within the administrative constraints of our system. So we have if you looked at our books across our HRA clients, we have a wide variety of plan designs. And so I think that that's what you're going to get when you come with somebody like us versus use the cookie cutter offerings by the health carrier. Also, and I'll just mention this too, when we go back to the first slide that I was going over and talking about HRAs help to foster this consumer mindset amongst employees, you know, they're exposed to the cost of their expenses, that kind of thing. If you've got an automatic carrier integrated product, there's no consumer, you're not introducing the concept of consumerism to the employee at all, because those claims are being handled in a back channel. The employee doesn't have to look at anything, and then they're not forced to file a claim. It's all handled like the old health plan was handled. So you're not really engaging the employees anymore in the cost of their coverage and the cost of those expenses when you're using the carrier integrated product versus somebody like us. So, great question. Another advanced example of same kind of design option Let's say we have the old health plan has a $2,000, $4,000 deductible, and we have a $2,000, $4,000 out-of-pocket max, and we have prescription copays of $10, $35, $50, and then most of the time there's a tier 4 that has no specific copay amount. You're just paying the full cost up to like $100. Let's say now at renewal, we have to look at another health plan design because we've been hit with a huge increase again. So we now move to a $3,000, $6,000 deductible. Then additional $3,000, $6,000 for the out-of-pocket max, and we have a generic copay now of $10, and then every other tier 2, tier 3, tier 4, the employee is paying 50% of the cost of the drug up to $100 max. Obviously, big change when it comes to the prescriptions for the employee. So what we could do is we could take an HRA, reimburse the back end of the deductible, then reimburse the back end of expenses that are applied to co-insurance if the group wants to do that. And then we could also reimburse for prescriptions over and above $50. So if, because the old tier 3 copay was $50, so the group just says, I don't really want my employees to have to pay any more than $50 for a prescription drug. So we're going to add in this HRA component to reimburse for prescription purchases over and above $50. So if the prescription costs $80, they would reimburse $30 back to that $50 amount. I would advise, and I have always advised employers that have put this type of benefit in place, certainly we want to have a cap on that prescription reimbursement benefit. I wouldn't advise to have an open-ended pot of money there, but it's really up to the employer. But I would advise implementing a cap for that prescription part of the plan. Again, key is flexibility, flexibility, flexibility. It could be put at the bottom of every one of these slides. And employee education when it comes to HRAs is very important. So employees know how to file claims, how to access the benefit, all that. I mentioned this earlier. We talk about full 213D HRA. Again, this is just the employer saying we're going to provide our employees, if you go to the example here, a bucket of money, $1,200 for all employees that are enrolled on the health plan. And that $1,200 can be used for any out-of-pocket 213D expense. There are several significant unique plan options with regards to this type of plan. The plan could allow expenses to be incurred, submitted at any time. There's really no plan year limitation requirement on a 213D HRA. Most groups do want to narrow that down to a plan year, but you don't have to. And then also you can allow carryover of HRA funds. So if you give this employee this bucket of 213D money, if they don't use it all, you can allow them to carry over all of it. You can restrict that carryover to a percentage. You can restrict it to a dollar cap. So a variety of options there when it comes to carryover. And one thing to think about if you're ever considering a 213D HRA is you could take that, you could offer that bucket of money to the employees, and then you could also have a health FSA, an FSA plan that allows employees to put some of their own money aside for their out-of-pocket expenses. And then they can decide how much they want to put in the FSA. Maybe they want to bank some HRA money for later years if you're allowing carryover. We have a plan design similar to that here at ProBenefits, and it works beautifully for employees to have a little bit of control of how much money they want to use of their own, how much of the employer's money they want to use. Another design option, and I mentioned this in an earlier slide, and Jason had mentioned it earlier as well, is the MERP plan design, the medical expense reimbursement plan. Basically, this is an employer just saying, we want to set up an HRA to reimburse one specific category of expenses, typically. For instance, you could have a dental-only MERP, a group that says, we're just going to get rid of our dental plan. We're just going to help employees. We're just going to give them a $500 bucket of money for their dental expenses. Dental MERPs, we have several of those on the books as well. They work very well. And keep in mind, if we're reimbursing any medical expenses, that the HRA, the MERP, has to be linked to a group health plan. But if we're only reimbursing dental and or vision, or this is a retiree benefit, then the plan can indeed be standalone. So you could just offer a dental-only HRA, a dental-only MERP, to all benefit-eligible employees if you want to do that. Carryover can be allowed, and that's, again, a valuable feature just like in the 213D HRA.
Jamie, a couple of questions before we move on. First of all, a comment before I ask you a question. We didn't put a slide in here with a breakdown of the HRA plans that we do administer. We administer between 400 and 500 different HRA plans. And as Jamie said, if you were to see a breakdown, certainly the most dominant plan design is the deductible reimbursement design or coinsurance reimbursement design. But within that, whether it's first dollar, last dollar, percentage, et cetera, whether it's employee only, spouse, family, the plan designs are myriad. So the good news is that we have not only experience, but also data on an incredibly large number of plans for employers of all sizes. And speaking of that, Jamie, can you speak a little bit to the kind of modeling that you can do or the kind of plan design assistance that you could give an advisor, an employer who's considering a deductible reimbursement or other type of HRA plan design model?
Yeah, absolutely. When you're an employer and you're looking at the possibility of implementing an HRA for the first time, or maybe renewing your HRA plan and tweaking a few things, I, along with Charles and Kim, our other benefits consultants, we can certainly talk with you and help you figure out, okay, based on what the employer wants to do, based on these different options, maybe we're reimbursing 1,000 or 2,000 or 3,000 of the deductible, and what we expect utilization to be, we can certainly help you with an analysis of, okay, will this HRA, pairing it with this alternative health plan, will it actually save the employer some money? So keep that in mind. I think that Charles and Kim and I are willing to do that when your group health plan, when your group is going to renew their health plan. If you want to talk about HRA options, we are certainly available to do that and to assist. And let's actually see if this plan is going to save money. And to be quite honest, there are times that I have told an advisor in a group, you do not need to move forward with the HRA plan. You need to just renew your current health plan because you're not going to save any money. But a lot of times the HRA is going to save some valuable dollars for the employer, and certainly that's something that we can help in that discussion.
Next question, Jamie, before we go to retiree HRA plans, can you speak to the use of the card and whether the use of the debit card or flex card that we certainly use for health FSA plans to a significant extent, whether the card is an effective reimbursement tool for HRA plans?
That depends on the HRA plan design, and that's a loaded question, Jason, but that depends on the HRA plan design. If we have an HRA that's reimbursing all 213D expenses, so they're giving the employee a bucket of money to reimburse any out-of-pocket medical, dental, vision expense, and a card is definitely an option there. But if the HRA is a very basic deductible reimbursement plan, for example, we do not want to pair a card with that. Why is that? Well, if you think about it, if an employee goes, and let's say they go get an MRI, I used the example earlier, you go get an MRI, you go to check out of the outpatient provider that's providing the MRI, and they tell the employee, hey, you owe us $1,800 for this MRI. If the employee had a card linked to their HRA that reimburses part of the deductible, the employee will pull out the card and they will tell the employer, yeah, swipe it, $1,800. Well, okay, we've got an issue because the provider didn't actually know how much the employee owed for that MRI. They've got to file it through the health carrier first, let the health carrier determine how much they are responsible for, how much is going to be applied to the deductible. Or if they're at an in-network provider, that MRI, the cost is going to go down to $1,300, $1,400. So now we've got an issue. If we've paid the provider with $1,800 with the card and the employee is only responsible for $1,300, $1,400, we've got several things happening. First off, the employee's card goes off because they swiped it for more than what they were responsible for. And then they've got to pay the card back because the card is being funded by the employer. So they've got to pay the employer back for that overused portion on that card swipe, and then the employee then has to turn around and try to get the money back from the provider. And as I joke in employee meetings, good luck with that. If you're trying to get money back from a provider, that oftentimes takes a while. So cards, it is very specific to the HRA plan design whether we want to pair a card with it or not. Retiree HRAs. Again, Jason touched on this. I've already touched on it as well. Retiree HRAs are a way that employers are using to manage rapidly rising costs associated with retiree group health benefits and to also help control future liability. The employer provides each retiree with a bucket of money for any out-of-pocket 213D eligible expense plus individual health insurance premiums. And then also maybe you have an employer that doesn't want to offer it for all 213D expenses for the retiree HRA. Maybe they just want to reimburse premiums. Well, that's fine too. The premium only model is an option. As Jason and I were discussing this morning, really and truly, the employee is going to use the money up anyway, probably for premiums. So I personally don't think that offering it to 213D eligible expenses is a problem. I think most employers that are implementing retiree HRA should consider doing that along with the premiums. An example is just giving a retiree $8,000 for the year for out-of-pocket expenses plus individual health insurance premiums. Obviously, that's a very nice employer in that example. I have seen retiree HRAs vary from $10,000, $15,000 down to $200 a month. So the variety or the range of reimbursement dollar amounts varies greatly with retiree HRAs. Carryover funds of these retiree HRAs, that is allowed if the employer wants to allow it. And most retiree HRAs I'm seeing, they are allowing carryover. But again, as an employer, you've got to think about that when it comes to future liability. These retiree HRAs can certainly be used in conjunction with a private exchange established by the employer for any health plan options. We've already touched on this a little bit, but I want to just emphasize what we bring to the table here at ProBenefits for you as an advisor and if you're an employer on this call when it comes to HRA administration. Expertise and help with employee education at setup. We will come out and do a group meeting for your employees or a webinar for your employees or a conference call to help explain the HRA to them. We can also talk with you about plan designs and what we see and things that may fit in better with the type group health plan that you're considering. We have a very efficient claims and reimbursement process. HRAs are reimbursed every week. So if an employee gets a claim in 1 week, they're reimbursed the next week. It's a very quick turnaround. Full admin and compliance support, and Jason went through the legal requirements and the compliance requirements for HRAs. If you're a client of ours, we do your legal documents, we do your SBC, your summary of benefits and coverage. We help you with the P-Core fee filing. We prepare that Form 720 and send it to you. All you got to do is sign and mail in a check to the government with the form. We do the MSP reporting when required, and then throughout the year, we can help you with reporting on your HRA plan. Certainly, implementing an HRA and then getting a gauge on how much utilization you have helps for future plan years and for future planning. So we can help you with those with reporting throughout the year on claims experience, that type of thing, and the employer has full web access and again reporting for both themselves and the employee, and the broker can have access, the advisor can have access to those reports as well. So I think we bring a lot to the table when it comes to HRA administration. Also, keep in mind, HRA administration is very low cost compared to any time expense that you are considering if you're considering self-administration. In this environment, I really don't think it's valuable at all for an employee to self-administer an HRA. There are too many compliance requirements, and when you look at the very minimal cost to have somebody like us take care of it for you, it just doesn't make a lot of sense from the employer perspective. Also, the second bullet point, and I touched on this earlier when we're talking about an integrated product with the carrier. A carrier has an integrated HRA. If you use that and then next year you move carriers, you move to another insurance provider, then you've got to figure out a place to house your HRA. Maybe they have an integrated option, or maybe you have to look at somebody else. If you're using us as your HRA administrator, we can work with any insurance company, any insurance plan. So you can move carriers year to year. That's not an issue with your HRA. And then we can also help advance the concept of health consumerism because, again, employees are forced to file a claim. They're forced to see what their expenses are. When they file claims with us, they have to see that and be exposed to that.
Thanks, Jamie. Jamie's not going to toot his own horn, so I will. Jamie and Charles and Kim do a tremendous job in assisting employers and advisors with plan design options set up, and they take a lot of pride in their work. And between them and our admin team, as well as Chris McCauley, our other benefits attorney, our team does a great job, and I'm appreciative of all of them and the great HRA service that we can help you with. I think we've covered most of the questions. Jamie, another quick word. Can you speak just and reiterate a little bit about the option for the HRA to supplement a plan that is HSA eligible? So example, we've got a high deductible health plan. The employer wants the employees to be able to open HSA bank accounts, but the employer also would like to take advantage of some premium savings through some deductible or co-insurance reimbursement. Can you just speak again? I know you referenced it earlier about the HSA minimum deductible and what some of the HRA options are in conjunction with that HSA eligible health plan.
Yeah, certainly HSAs are a beautiful thing. You know, if you as an employer or your group as an advisor, your group has already made the choice to go to a high deductible health plan with HSAs, you like the idea of employees being able to put money in this HSA account, which, by the way, we offer HSAs as well for those of you looking for an HSA solution. It's certainly you've made that choice. HSAs are a great tool, but now again, you're being hit with a high renewal, so you need to bump that deductible up. And you want to help the employees with that higher deductible. The key with a HRA that reimburses on an HSA eligible health plan is if you want to protect that HSA eligibility, you have to protect the HSA qualifying deductible amount. So just a concrete example, let's say that you've got a group health plan that has a $1,500, $3,000 deductible. It's a qualifying HDHP for HSAs, all right? And your renewal's high, and so next year you're going to have to bump that deductible. Let's say you're renewing for December 1st this year, and you're going to have to bump that deductible to help with premium savings. You're going to have to bump it up to $2,500, $5,000. You could implement an HRA to reimburse that from $1,501 to $2,500 on that group health plan. Why is that? Because you have protected the HSA qualifying deductible amount of $1,300. So the key in an HRA paired with an HSA eligible health plan is we just have to protect those HSA qualifying amounts. So we got to protect that HSA qualifying deductible of $1,300 or family deductible of $2,600. So HRAs can be indeed valuable tools on an HSA qualifying high deductible health plan.
Thanks, Jamie. If you have any more questions, feel free to submit them now through the question box. Jamie and I are going to hang around for a few minutes. You're welcome to email Jamie. His email is jamie@ProBenefits.com. You're welcome to email him now or later with any questions. I think we've gotten to all the questions submitted during the session, either in writing or orally during the session. Our next client webinar is going to be on Tuesday, November the 17th, and we'll be focusing on FSA plans, pre-tax benefits under Section 125, what employers need to know, and some updates regarding FSA plans as we come up or continue during this enrollment season. So that's Tuesday, November 17th. As always, you can find a schedule of webinars on our website, a place to register for websites, and recording of prior sessions. We will be posting a recording of this session as well as providing a copy of the slides. So thank you for joining us. If you've got any more questions, feel free to submit the question through the question box here in the next few minutes, and Jamie and I'll be around for at least 5 or 10 more minutes to answer some questions submitted through the question box. And thank you for your time today. Have a great lunch and a great afternoon.